Hello everyone, and welcome to this week's video on curb and stair negotiation, which is just saying that we'll be learning how to properly go up and down the stairs with your patients and with an assistive device. So first, how to ascend and descend stairs or curb with a few different types of ADs. So first we'll start with a walker. So for ascending or going up the stairs or a curb, you want to always stand behind the patient and slightly to either side of their affected side or leg or extremity, or with their side that has the least support. So you want to always hold the patient's gait belt with a supinated forearm at the patient's back. And then you want your other hand, you can place it in front of their shoulder, whichever side you're on. And this can help you counteract or assist them in any way that you need to. And then you want to maintain a wide and staggered base so that you have a good base of support. And then you only want to reposition yourself only when the patient is stationary and safe. And then for cues for this, for going up the stairs, you want the patient to stand close to the steps or the curb. And you want to place the walker to the side that is opposite support of the rail or the clinician. And then you want to place the walker so that the opening is toward your patient. And then you want them to hold the front hand grip of their walker. And then you want to make sure that the legs on the walker are on, the two of them are on the step above them, and then the two are below. And you want to make sure that all the legs are secure on the steps. You don't want it moving while your patient's putting their weight through it. And then if their right lower extremity is affected, you want the patient to lead with their left leg on the step. And then your right leg will follow. And then you move the walker up to the next step, and then you repeat as long as all the legs of the walker are secure on each step. And then if the lower left extremity is affected, you want the patient to lead with their right leg on the step, and then their left leg will follow. And then you want to advance the walker up the next step and repeat as long as all the legs are secure on the steps. Then next we'll go on to learning about descending or going down the stairs or a curb. So you want to stand in front of the patient this time, just in case they fall down, because when you're going downstairs, your weight's more going to go forward than it is going to go backwards. So we want to be in front of our patients and slightly to the side of their affected side or the side with the least support. And then you want to hold the patient's gait belt with a supinated forearm, the same as you did before, but at this time you do it at the patient's front since you're in front of them. And then your other hand can still be at their shoulder, but it'll be like this time in case you have to push them back. And then you also still want to maintain a wide staggered base so that you have a good base of support. And then you want to reposition yourself only when the patient is stationary and safe, just for safety for both you and your patient. And then cues for this would be that the patient stands close to the steps. We place the walker to their side that is opposite of the support or rail or the clinician or us. And then we want to place the walker so that the opening is still towards the patient. And then this time, when we're descending, we want to make sure the patient is holding the back hand grip. We still want to place the legs of the walker on when the two of them are on the step above and below. And then you want to check to see if all the legs of the walker are secure. Then for going downstairs with a walker, if the right lower extremity is affected, you want the patient to lead with their right leg down because you want your bad leg to go down first, and then you want your left leg to follow, and then you want to advance the walker down to the next step and repeat as long as all the legs of the walker are secure on the step. And then if the left lower extremity is affected, you want the patient to lead with their left leg going down the step onto the step below, and then your right leg will follow. And then you want to advance the walker down to the next step and repeat as long as all the legs are secure on that step. And then next we'll move on to crutches, which this could be auxiliary crutches or it could be the forearm crutches. So when you're ascending or going upstairs or a curb, you want the same aspects as ascending stairs or curb that I stated earlier, because they're also relevant to this type of AD, but there are a few minor changes, mainly for cues. So cues for if the right lower extremity were affected, this would have the patient leading with their left leg on the step first, and then the right leg will follow, and then the crutches will both follow. And so then next for the left lower extremity, if it were affected, the patient would lead with their right leg on the step first, their left leg will follow, and then both crutches will then follow up too. And now for descending or going down the stairs or a curb with crutches, it is also the same aspects as I stated before, because they are also relevant to this type of AD, going up and down stairs. So we're going down, there are a few different changes. So cues for going downstairs, if you're with auxiliary crutches, it would be if your right lower extremity were affected, you would lead with both crutches first, then you would have your right leg, and then your left leg would follow. And then for the left lower extremity, if it were affected, you would lead still with both crutches down first, and then you would have your left leg and then your right leg go. And then next we'll move on to a cane. So if you are ascending or going upstairs or a curb with a cane, it would be the same aspects as ascending stairs or a curb that I had stated earlier, since they also apply to this type of AD. But there are also a few little changes that we'll make, mainly with cues. So first, for the right lower extremity, if it were affected, the patient would lead with their left leg down, and then the right leg would be next, and then your cane would follow. And if your left lower extremity were affected, the patient would lead with their right leg onto the step, and then their left leg would follow, and the cane would follow up too. And then if you're descending or going down stairs or a curb with a cane, this would be the same aspects as I stated earlier, since it's relevant to this type of AD as well. And then we would change a few things, mainly with cues. So when you're going downstairs, if your right lower extremity were affected, you would lead with your cane, and then you would have your right leg go next, and your left leg would then follow. And then if your left lower extremity were affected, you would lead with your cane first, and then your left leg would go next, and then your right leg would follow. Well, that's it for all of our different types of going up and down with different types of ADs. If you have any questions, please drop a comment. Thank you for watching.